Welcome back. Now, 45 children under the ages of 5 reportedly died from malnutrition-related conditions in the Omaheke region this year. Now, in a telephonic interview with NBC News team earlier this week, the Omaheke Region Health Director, Jeremiah Shikulo, revealed that the malnutrition has become a concern in the region owing to a lack of proper diet, and further highlighting that the region has recorded 132 cases of malnutrition since January. Now, in the same light, the Nutrition and Food Security Alliance of Namibia, an umbrella organization for civil society organization, academic and businesses working in the sector of nutrition and food security, recently facilitated a session for the Omaheke Malnutrition Task Force. Now, the Malnutrition Task Force, established in March 2022, consists of representatives over 20 different ministries and non-governmental organizations working in the area of nutrition and food security. Now, Director of Nutrition and Food Security of Alliance of Namibia, Ben Schernick, now joins us in studio as we further unpack the issue of malnutrition in that region and discuss further their findings during their facilitation. Good morning, Ben, and welcome to GMN.
Good morning. Thanks a lot.
Okay. Now, we understand that earlier this year you traveled to Omaheke to identify and engage organizations working within the food and security sector. I mean, food, nutrition and food security within the Omaheke region. So, what were your findings?
Well, we came to Omaheke and particularly started focusing on Gobabis, because as a civil society alliance, we were interested to find out which civil society organizations, community-based organizations are working in this area. And we picked up that already since last year, the governor has taken initiative to put this malnutrition task force in place. So our idea was to connect with the task force and to identify who is doing what, because those 45 cases, they are the tip of the iceberg that the Ministry of Health has picked up. But the problem is much deeper, because they receive those malnourished children, they identify them through the community health workers or at the clinics, but then they treat them in the hospital and have to send them back at some point, but then they are returning again. So even those cases that are not reported as death, those other intakes of malnutrition, they are an indicator for a huge problem within the community. So we wanted to identify who is working in health or food production, food security related areas. And secondly, what exactly is being done to address the underlying causes and what are the underlying root causes. And there we found a couple of things.
Now, based on your findings, how would you describe the current status of malnutrition within the region?
It's extremely worrisome. I mean, there are calculated national statistics of about 600 malnutrition deaths in the country, and if you take the over 40 figures from Omaheke this year alone, you come to almost triple the number that we had on an annual basis. So that is a very worrying trend, and I would say that is why malnutrition, or the death alone, that's really kind of a very hidden disease we have in this country. Not really a disease, but it's a state of crisis that we have, because the deaths, as I said, are just the tip of the iceberg. But under that, you have a lot of malnutrition cases. Last statistics from 2013 say that we have a quarter of all children under the age of 5 stunted. And stunted is one of the forms of undernutrition that has a real impact on people's development and also on national growth. So that costs about $11 billion, according to a study from last year, per year. So just the losses of malnutrition alone. And those 1/4 of all children is statistics from 2013. So with all the economic depression, the droughts and COVID, the war now, you can imagine that this figure is much higher. And we found huge also social factors that impact malnutrition. And these are the social factors, and the food access, the diets, what people eat, how people eat, how we parent our children. All of these factors impact then on the malnutrition death that we see now reported. But we really need to have a multi-sectoral approach to address the underlying root causes. And that's what we've been trying in the Omaheke region, and that's also our mandate on a national level.
Okay. Talking about your mandate, what is your role, especially when it comes to the National Food and Nutrition Coordination System?
Well, we are, so government itself has a food and nutrition security policy that was revised in 2021. And NAFSAN's role as a technical partner is to link civil society, academia, and the businesses into that network or into that coordination structure. So there's still some difficulties with getting the actual coordination structure efficiently functioning. So we're also providing technical assistance or trying to on that. But we are responsible to coordinate the members that we have, to inform, to connect, and to also advocate on issues. So issues around nutrition that needs advocacy for is, for instance, breastfeeding, better maternity leave for especially the small children, the first 1,000 days, but also access to food. And there we talk about the basic income grant as an ideal tool to really provide for the majority of people. There are also studies in that regard that prove the effectiveness of it, but also to promote indigenous foods and generally healthy diets.
Now, you mentioned the issue of the revised national food and nutrition policy that was, this plan also that was was launched for implementation in December 2021. How would you rate its implementation thus far, 2 years later on?
I think the politically correct answer would be not as advanced as I wish. I think it really, let me put it this way, there was great political will and ownership and coordination in developing or in revising this policy over a period of 3 years, where UN agencies came to support the government, where private sector, civil society was engaged, and multiple ministries that really worked very well together over the course of 3 years to develop that. We went into the regions as a team, had regional stakeholder engagements and so forth. And up to the launch, it was really a great success. And I wish for a similar success in implementation, if that is answering the question.
Now, apart from Omaheke region, what other regions are facing malnutrition that have come through under your surveillance or through your engagements?
Yes. So NAFSAN itself is also a non-profit organization. So we highly depend on membership fees a bit, but also then on donor funding. So one of the major donors we have in the moment is GIZ Namibia, but also the EU in the moment. And through the EU, we are able to really travel and visit and engage in 3 regions. That's Hardap, Omaheke, and Otjozondjupa. So we can only speak from personal experiences from these 3 regions, but malnutrition is an issue across the country.
What's the current status in, for instance, in the Otjozondjupa region?
That one we still have to visit, to be honest. But we know that there are also quite concerning cases around malnutrition as well, but we haven't directly engaged yet. So our funding for that project only started earlier this year, so we only visited Omaheke and Hardap. But we are going to also visit Otjozondjupa. But key regions normally also prone to malnutrition is up north, Kunene. But even regions that are relatively fertile in terms of agriculture production, like the Kavangos, are also... So it's really a national phenomenon. It's a national crisis that we have. Also down south. And you have, as I said, a lot of other social behaviors like alcoholism, drug and substance abuse, bad parenting practices, or lack of knowledge of what a healthy diet is. So when people, let's say, put potatoes or pap and rice on the same plate and think that's a diverse food, but it's both the same food group, so you don't get the vegetables, the vitamins and all of these stuff, or the proteins. There's a lot of proteins you get from plants, so it doesn't need to be expensive meat. So these are the information we'd like to share that people don't have the knowledge about. Plus the eating practices are, I think, across the country almost, very much starch and meat-based.
Okay. Let's talk about the issue of alternative means, especially the fact that most people are unable to afford the sort of diet supplements that we want to get in stores. And it comes to the component of indigenous food items that are available. What is being done to actually encourage, especially those that are living in the rural areas, it is possible to use indigenous food and still be able to have a healthy diet?
Yes. For instance, a fun fact is that marula fruits, for instance, have a 10 times higher vitamin C content than lemons. So there is a lot of rich nutrient content in those indigenous fruits, and UNAM and NAST and other institutions are doing increasingly research. So our role is then also to bring that research across, whether through the resource library, through videos, talks, that we want to make then available. We also developed over the last 2 years, together with different stakeholders, nutrition for health training. That is very fun and engaging over a period of 4 sessions, to really bring that knowledge across and to promote the existence and the utilization of indigenous foods. Because the idea is to really be able to produce or to access food locally, and with all the Western or capitalist kind of influence around the modern life, so to say, we kind of tend to value certain types of food that we see in the supermarket and really neglect the indigenous foods we have. And there's so much more. So even also agriculture, the Ministry of Agriculture is moving in that direction. So it is a growing trend. But there's much more awareness to be created. So that training, for instance, is one of the key approaches where we hope to reach different populations in urban and rural areas, but not directly through us. So we are not an implementer, but we are currently looking for strong partnerships to provide funds so we can print and make that material available, and then train people from ministries, NGOs to then go into those regions and engage people, inform them and motivate them to consume more healthier, but also to plant their own foods.
Okay. Well, Ben, thank you very much for making time to speak to us this morning.
All right. Thank you so much for inviting us and talking about those issues and the underlying key factors.
Okay. Now, that was Ben Schernick, who's the Director of Nutrition and Food Security Alliance of Namibia, talking to us about the malnutrition situation in the Omaheke region, but also generally that affects the whole country, and also there are plans to visit that is Hardap region as well as Chunjuba region to assess the situation of malnutrition with regards to children within those regions. Now, stay tuned. GMN gets written shortly after this break.